That's all. Good afternoon, dear patients. Today we will talk about a case involving dark spots on the penis. It is shown in the picture. What is this? So the patient came in, a 44-year-old patient came to the clinic complaining about the appearance of dark spots, specifically on the foreskin of the penis. And recently, just a few days ago, itching and burning in the area of these spots also appeared. Indeed, you can see small erosions covered with crust at the edge of one of the spots. They are even located on the glans now. So accordingly, a preliminary diagnosis of genital herpes was suspected, which of course was not directly related to the spots, but still, first it was necessary to address the issue of infection and then move on to the dark spots. Accordingly, tests were taken from the surface of the rash as well as from inside the canal for sexually transmitted infections. This is PCR-15, the standard panel. In addition, a smear was also taken from inside the canal as part of a comprehensive examination. Accordingly, genital herpes was indeed detected. PCR tests for genital herpes were taken from the blood as well as antibody tests. It turned out that immunoglobulin G was positive, while immunoglobulin M was negative, which indicates an old infection, and apparently a recurrence of genital herpes that went unnoticed by the patient. The patient has a regular sexual partner, his wife. He has not had any other sexual partners for a long time. Accordingly, first, a complete blood count and an immunogram were ordered to determine whether immune correction was necessary. The medication Valver was prescribed orally. As a result of the immunogram, additional medications Igaron and cycloferon were prescribed, as well as the intravenous drug ozone. As a result, these kinds of eruptions resolved. Next, the search continued regarding the diagnostic dark spots. First of all, the penis is a place where, among other things, malignant tumors can develop. Accordingly, oncocytology was performed by taking samples from the surface of these spots. Secondly, the S100 protein was tested in the blood. The results showed that no oncology was detected in any of these tests. Accordingly, these spots were removed using the radio wave method. Most of them were sent for histological examination, which revealed seborrheic keratosis histologically. Seborrheic keratosis is a fairly common neoplasm. You can find a more detailed explanation of what this is in a separate video on our channel. There is more than one. And essentially, it represents a kind of skin aging. As a rule, it is not dangerous. However, considering that, as I mentioned earlier, the penis is already considered a high-risk area for cancer, it is advisable to remove all precancerous conditions from the surface of the genital organ, which, in principle, includes seborrheic keratosis, albeit indirectly. Therefore, in my case, these neoplasms were correctly removed, and accordingly, the patient was advised to undergo repeated removals if they reappear. That's it. Based on this, it is always necessary to do not only an examination, but also certain tests. Which tests are needed depends on each specific case. The most important thing is to rule out oncology in cancer. And as I already mentioned, the penis is a high-risk area for cancer. That is, the genitals, not just the penis, but all genital organs, both in men and women. And accordingly, when removing tissue, especially in cases where the diagnosis is not entirely clear from a clinical standpoint, it is always better to perform a histological examination of the removed tissue